I'm often asked the question whether consumption of alcohol is a risk factor for developing breast cancer. The answer is yes, it is. In the Journal of the American Medical Association, published the week of November 2nd, 2011, is an important article from Harvard University on this very subject. Now, this subject has been studied a fair amount through the years, but I think this is one of the more comprehensive studies to be published. On our website, we will have a video link to the author of the study, and she goes through a lot of the details of the study. But the bottom line of the study is that if you consume somewhere between 3 to 6 drinks per week, you have an increased risk of breast cancer of approximately 15%. Now, the average person without other risk factors has a chance of developing breast cancer in their lifetime somewhere between 10 and 12%. So this additional 15% of 10 to 12% is not a huge jump, but in fact it is an increased risk factor. Now the dilemma is that we know some of the benefits of, as an example, red wine. So how do we balance the benefits of red wine consumption to lower the incidence of heart disease against the increased risk of breast cancer from consuming, let's say, 3 to 6 glasses of wine per week? And the answer is you really need to consult with your primary care physician, because we have to take into account other risk factors that may be in your history, such as family history, such as being overweight, such as cigarette smoking, such as never having babies, never having children at all. So there are a multitude of risk factors that go into the development of breast cancer. We have to always remember we don't know the exact cause of breast cancer, but we need to keep in mind that, in fact, the consumption of alcohol between 3 to 6 drinks per week is an increased risk factor. But we also need to keep in mind that less than 3 drinks per week has no increased risk of breast cancer. What's the take-home message for you? Know what your risk factors are. Consult with your primary care physician. And if they're not the answers you need at that source, then consult with a breast disease specialist where you live. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.